Center, Dr. Billy Joe Baptiste, our Director of Health Services, Dr. Kathy Calver, our Director of Mental Health Services, and I will turn it over to them. Thank you, guys.
Thank you, Stephanie. This is who we are. We are going to tell you our story about our integration efforts because we'll tell you the story, why we're doing it, and we would like to tell you a little bit about where we see it going to, because when we do these presentations and really think about what we're doing, we get an opportunity to look at it from a 30,000 feet level and be able to kind of solve problems and identify things we can improve on. So we all want to really encourage you to think about it and listen to our presentation with a critical eye and ask us questions. It'll just enrich our experience and help us through as well. We will be talking about the Wellness Center. Wellness Center is housed in our rec center at UCCS. And that's not an accident. We wanted to make use of each other's strengths with our close partners, and Rec Center is absolutely one of our closest partners, so we wanted to be physically closer to them. At the Wellness Center, we also have health services, mental health services, wellness promotion is housed with us. Within wellness promotion, we have dietetic services, we have some contracted clinicians, contracted services with massage therapy, chiropractor, and we just lost them, but we're hoping to replace them with physical therapists as well. So let me tell you a little bit about what were the driving factors for our decision to have an integrative care model. First of all, we were really a small two-unit health and mental health services, very small two-unit office. Stephanie was the head of the health services. I was the head of the mental health services. I'm a clinical psychologist. And we started to work together very, very closely across campus. This little satellite image shows us our campus, and mental health services is the blue line, and the health services is used to be the red line. And we would actually walk people back and forth because we wanted each other's services to be in our patients, our clients' worlds, because we understood early on the significant importance of each other's services. And so distance was a big barrier for us to be able to do that. Do you get blizzards here? Lots of blizzards where we had to walk people back and forth was not conducive of wellness. Strong working relationships happened when we found articulated and made it explicit that we have common goals and values. And we started operating from them. We started saying we will serve all students who need us. We do not turn anybody away for inability to pay or any other reason. We serve all of the students who need us, and everyone we serve deserves the very best we can to provide the best services possible. So that is important. Being able to articulate this, we found, is important because across the country, when we look at efforts to have integrated care, we find that there are some conflicts that arise from shortage of resources, cultural differences between different areas of expertise, etc. So we thought if we could just come together with common principles, values, goals, we can just make our decisions according to those first and foremost and eliminate a lot of the confusion and challenges that maybe other people may be experiencing. Wanted to be leaders with a holistic approach. This mutual desire stemmed from our success stories. There were a lot of very complicated cases that we treated together, and there were a lot of very impressive success stories given how little the resources were, how we really didn't have a whole lot of staff, and our capacity to deliver very varied services at the time were very limited. So we started telling our stories and sharing our experiences both within our teams and across campus. Capacity issues was a particularly important driving force too. We didn't have much space the way things were in two office setting. We didn't have space, and we decided that if we could partner and join forces, our space may expand and allow us to provide more varied, more diverse number of services for our students. Leadership buy-in was, of course, very, very critical. And how the primary strategy we deployed for this purpose was to always include a joint solution to each of our problems, issues, as we were having discussions during meetings. So in meeting minutes, you would see a lot of, if we could come together and cohabitate, if we could have an integrative care model, this issue would have been resolved in this way. So leadership, over time, leadership started to share our vision by our offered solutions to the, at the time, really important, seemingly insurmountable problems. Student buy-in and input on what we were suggesting was also critical when we educated them about what our vision was, what they would get. They were our biggest advocates and our advisors. They became our advisors because they were the ones on the receiving end, and they helped guide us about how the outcome should look like. And we really took it seriously and started to allow them, through our advisory boards, started to allow them to have a loud voice in our decisions. So when we merged, when we came together, because, you know, we're kind of pulling offices from and services from different parts of the campus, our budget became this really blended picture. We have student fees, which is the 60% of our total budget. General fund, which comes from, as you know, tuition dollars and pays a lot of our mental health services staff salaries. Mental health services revenue and health services revenue is for the fee for service system we have, and they are about equal, about 4% each. And wellness promotion also is supported by student fees. And the student fees portion is, of course, voted by the students. Like, we go and ask for money, and we say, this is what you're going to get, and they give us their vote of confidence. So, how does it all work? How do we move forward with that? Next, Dr. Billie Jo Baptiste will be talking about the strategies for successful integration next. Thank you so much.
Let's go. I want to make a big loud noise. There we go. Okay.
Hello. All right, so I'm going to be talking about the collaboration efforts that we are currently doing. But it's important to know, when we were building relationships, it was very intentional. We were put together in groups to figure out about our moving and our integration and how we're going to run all of that. So it was very helpful to meet the team that you were going to be working with. And our integration did not take away from our uniqueness of each department, but if you do it the right way, it'll only enhance each department. So let's talk about integrated education. So Lunch and Learns, the Wellness Center, we host Lunch and Learns, and we usually have topics that are of interest to all of our employees. We even have procedure workshops, and those of you who know Benik, you probably don't know that she is a master at suturing chicken cutlets. So if we ever need her to jump in on the medical side, she's ready. All right, so again, these are things that we do together. Also, we have community presenters come into our clinic. We host speakers, and we open it up to anybody in wellness or rec who wants to come listen. And when we talk about having everybody in there together, it's usually about things in our community, things in our university that are open to students, and topics that are hot topics at the moment. So like, for instance, we had a SANE nurse come talk to us, and they came and talked to rec and wellness, and they gave us community resources, let us know what's out there. So it's really good for everybody to be on the same page and know what we have around us for support. Okay, moving on to screening tools. So I became our Director of Health Services February of 2020, which is like the worst, first time becoming a director time. So what did I do? Besides COVID, I decided to partner with Benik and create a screening tool for our medical patients. It was a suicide screening. So Benik came over and talked to all of our providers and said, okay, this is the screening tool, this is how you read it, this is what you talk to the patient about, and this is when you come get us immediately. So we have literally walked across the hall to our mental health providers and said, I need help with this patient, this is very serious. They come over and we see the patient together. So it's a really good collaboration, and it's a really good way to help our students. All right, substance use. So currently, Health Services is collaborating with Wellness Promotion, which is Chrissy, and her group. We're doing the Narcan training on campus. So we do Narcan training for staff, faculty, students. We've been going to groups, we're going into classrooms, and we're providing Narcan for everyone and doing the training at the time. So that's a really good collaboration, and one of our newer ones. We are also implementing alcohol and drug screening so that we can refer those appropriate students to mental health who need substance use specialists. And we also have free fentanyl strips in our waiting room at the Wellness Center, so students can come by anytime and pick those up. It's right by the condoms. So, all right, food insecurity. In health services, we also added a food insecurity screening question on our medical history form, so we can identify those patients that have food insecurity. And then we do have a pantry on campus, so we can give them that as a resource. And we can also give them community resources. Not everybody lives on campus, or it's convenient for them to go to our food pantry, so we have a whole list of community resources as well. Okay, so team approach. Shared records. We had many discussions about this prior to our integration. So especially for our mental health providers, we had many discussions where they could share their concerns. But what it came down to finally was we had to trust each other. And as a group that has been integrated properly, we did trust each other. So there are options for patients to opt out of sharing records with medical and mental health, and we've only had maybe less than a handful of patients that actually decided to opt out. But there's also, if there's a concern, say my niece decided to enroll in UCCS and she was seeing mental health, well, my name is going to be blocked from being able to get in her chart. So there are fail-safes as well, just in case. We have treatment teams. We have an eating disorder treatment team that consists of our medical providers and our dietitian, our psychiatric mental health nurse practitioner, and our medical providers. So we meet monthly, and we talk about any of our patients that we have that has the eating disorder, and we decide what we're going to do as far as a treatment plan for this patient. So the multidisciplinary team approach with these patients with disordered eating is by far the most promising practice. And we're definitely trying to treat our eating disordered patients that trying to treat them in the best way that we can, and also come up with a specialized care plan for them, because not everybody fits the same mold. All right, we also have a trans and gender nonconforming group. Same, we get together and once a month we talk about our patients. We come up with a care plan so that it is special just for that one patient. And again, not every care plan works for everyone, so we make sure that we come up with a specialized plan for them. All right. And as Benik had mentioned, we also have a chiropractor and a massage therapist. So our nurse practitioners can actually collaborate with those providers and come up with holistic care for all of our students. So we also collaborate with the rec center. So we do all of the club sports physicals for our students. We also created a Microsoft Teams channel for sports. And then we have a little a spreadsheet, and we will actually go in and we'll put the patient's name on the spreadsheet, say yes, they were cleared. So we found a HIPAA way to be able to talk with our rec center, and we have the students don't have to take paper back and forth, so it also saves paper, which is really nice. All right. My next slide, hiring practices. So when you have a group like this, you want everybody to help make a decision on who you're hiring. So we make sure we have search committees that include at least 2 people from the Wellness Center. We make sure there's medical, that there's mental health. We also reach out to rec, and then we reach out to other campus partners as well. So we want everybody to have a say in who we're hiring, and we want to make sure that we have the best fit for everyone. Combined policies. So we do have shared protocols. So we have wellness center protocols, we have medical protocols, and then we have mental health protocols. So, but we do have one that is just wellness center, and that's all of us together. And we often have meetings so that we can talk about our protocols, and are these the best ones? Should we fix this? Should we change it? Should we update it? So everybody has a say in our protocols. As far as our decision making, we have all staff meetings where the entire wellness center will meet. And we usually do that, is it once a month that we do it? And then we also have rec and wellness. We also have meetings with them. So we make sure, so we're not just having our, we're having our medical staff meeting. We make sure that we have staff meetings with the big groups as well. That way everybody can have a say what's going on. We also have leadership meetings, and we have those once a week. And that's where we tweak little things. We talk about, you know what, this didn't work this week, so how can we change this? So it's ever evolving. We don't stick with the same thing. I'm sorry, this is how we've always done it. We're gonna have to do it this way. We always have everybody have input in it. Okay. All right, now I'm going to turn it over to Dr. Kathy Calvert so she can talk about some of our care cases. Thank you.
Okay, so we thought it might be interesting for you to hear about some of the cases that we've had when we've worked together and how they've turned out. So I'm going to share several different cases of students who've come in and been able to use both medical and mental health. and how we did that. What Billy was talking about earlier and what Bennett was talking about, one of the advantages of this integrated model is the fact that we're in the same office. So when Billy talks about going across the hall, it's literally just a short hall, which is really nice. I was in private practice for many years before I came to UCCS, and I can tell you trying to collaborate with medical providers, psychiatric providers is really hard to do when you're not physically in the same space. So this has been really wonderful to be able to do this. So the first two cases I want to share with you, we had two different students, two different clinicians, both students having a fear of needles. And so both of our clinicians did exposure therapy and worked with them on being able to get comfortable. So that kind of looked like they met with the medical assistant who came into the therapy room, just told them what was going to happen. Then the next time, the medical assistant came in and said, this is what's going to happen, and here is what a needle looks like, and here's the tourniquet that I might be using, those kinds of things. They progressed. Eventually, they were able to go, and they would sit in the medical lab, just sit there where they were going to sit to have the procedure done. And then the next time they came in, they sat, and then they actually got to touch the needle, touch the tourniquet, but be in that space. And of course, all the time while they were doing this, every single session, the therapist was in there actually working on emotional regulation, helping them with their distress tolerance, being able to get them to the point where they felt really comfortable. And eventually, both of them were able to successfully, one got a shot, that was what they needed, the other one got their blood drawn, which is what they needed. Both were success stories, both talked openly about how much they appreciated what we did and how that worked so well for them. And even the medical assistant who's still with us talks about that as a really positive experience for them as well. I think one of the key pieces is the person who had to have their blood drawn and had this really significant fear of needles and having that procedure done was actually in the Bethel nursing program and needed to be able to do this so that they could finish and graduate, and they did. So that's definitely a success story for us. So another one, Billy sort of talked a little bit about the work we've been doing with eating disorder clients. If you've ever treated an eating disorder client, you know that a treatment team is the best option for them. Usually you want to make sure that there's mental health, a medical provider, psychiatric provider, dietitian, and then anything else that they might need, maybe a family therapy, those kinds of things. So one of the things we were intentional about when we built this facility was to make sure that we had a space, and that's our teaching kitchen, where we could do some of this higher level of care. We wanted to be able to provide a little bit more so that our students maybe could do kind of an intensive outpatient idea where they could do several types of groups, they could see their doctor, they could see their dietitian, all of those kinds of things while they're still in school, because we know that if they have to go to inpatient or intensive outpatient, sometimes that interrupts their academics. So that was our goal when we first came together. We have an example of one of the clients that we worked with. This was a client of mine, and Billy was the medical provider. This person came in with a diagnosis of anorexia, and at the point of coming in, the anorexia was at a severe level, restricting. And so we immediately started working to try to get them into the medical side because they were not seeing a doctor on a regular basis. So I started working with them, got them set up with Billy, and throughout their time with us, Billy was able to make sure that she was monitoring medically. And there did come a point in time medically when we determined that she definitely needed a higher level of care than what we could provide. So she actually did go into inpatient at ERC for about 6 months, which is a long time to be inpatient. But that was what she needed, and it was really appropriate. She came out of the inpatient, continued to do intensive outpatient, but kept seeing Billy at that point. And then when she was back to just outpatient, started seeing me again as well. This particular student was able to actually graduate, even though she had that 6-month where she was not in school. She was able to graduate, and I actually saw this person just about a year or two ago, actually just in the community, and was still successfully in recovery, was doing really well, and talked about how much she appreciated the ability to have medical and have that team. She was seeing our psychiatric mental health nurse practitioner. She was seeing a dietitian that we had at the time that was helping her as well. And I think the thing that was, the part that was really helpful for me as the clinician was being able to talk to Billy on a regular basis, being able to have information. As I was going into a session, Billy could say, hey, the blood work came back and this is what we're looking at, and really explaining it to me. The other piece that was really helpful was because we were at a point at one time where we were watching and paying attention to see medically if she was okay. So weight was one of the things we were watching, right? You can't get below this weight. If you do that, this is the next step we're going to go. So what we did was she would come in right before a therapy session. The MA would do a blind weight with her, and then I would be able to see that information before I went to go get her out of the waiting room. It was really, really helpful. And having that ability to do all of that in real time is really amazing. So that's another one I think of our success stories. All right, the last one I want to share with you is two different individuals, and I just want to share kind of the perspective of sometimes it's the therapy side where we're actually the ones that are seeing the client first, and then we're reaching out to medical, and sometimes it's the other way around. So both of these patients were my patients, and the medical provider for both of these was actually Stephanie. The first time with the first person, the trans man, this student came in literally during move-in, their freshman year, with their parents and said, I want to transition and I want to start hormone therapy. And so met with Stephanie. They had a great conversation. There was a lot of support, but Stephanie determined it would probably be really helpful for this person to also be in therapy. So then reached out to me and asked if I would take this client on. So during the time that we worked together, we were able to also spend a lot of time talking to each other. This was near the beginning of when this was really, I think, when we'd first moved in. And it was really the first time we had started doing hormone replacement therapies in the facility. So there was a lot of newness, there was a lot of educating each other, there was a lot of talking about what we've heard, what we know, and being able to do that with each other was really helpful. Also, Stephanie came into the therapy session a couple of times with that client. Same thing with the other one, the trans woman. But this time I was the one that actually was initially assigned to this person. And during the work that I was doing with them, they talked about the fact that they weren't happy with their community provider. So they had met a lot of the other medical providers because they had done other things within our wellness center. But I suggested maybe they would like to meet with somebody who could then take over their medical treatment. So Stephanie then agreed to come in and meet them. And just being able to have that opportunity for them to just sit with Stephanie while I'm sitting there really made the client feel so much more comfortable. And she was willing, and she really, I mean, of course, she really liked Stephanie, so that was easy. But she also was really more comfortable talking about it because I was sitting there, and also talks about the fact that that made this process a little bit easier. With this particular patient, we had to be careful because there was some medication noncompliance, and so this particular case was a little bit more intense, and so there was more conversations between Stephanie on a regular basis. So these are just some examples of what we've done and how we've utilized the fact that we have space together, that we have different expertise right there in our office that we can grab and use on a regular basis and just have conversations and not have to make a phone call to a doctor's office and say, I would like for them to call me back. And half the time when I was in private practice, I had to make sure that I said, this is Dr. Kathy Calvert, to get a doctor to call back. Especially with psychiatrists, they weren't always as open to calling back as easily. So it really is nice to not have to have that particular hurdle when you're trying to help take care of your patients. All right, so I'm going to turn this over to Chrissy Bailey, and she's going to finish talking more about some of the whole wellness programs that we're doing.
Thanks, Kathy. So my name is Chrissy Bailey. I'm currently the Assistant Director for Wellness Promotion at UCCS. Prior to this role, I was the office manager for the Wellness Center for 8 years. So that's the role I was in when we moved to this model and as we were building it. So I wanted to share just quickly a little bit about the administrative pieces of our integration and some of the important pieces about that. One thing is we've really realized the critical role our front office staff plays. We've designed our wellness centers so every student that comes in, regardless of what kind of service they're receiving, they start at the front desk. So all of our calls come in there, every student checks in and checks out there. So those folks at the front desk have a lot of responsibility. and a lot to keep track of. So we really value them highly, and also are always training and coming up with more efficient protocols to make their lives easier, as well as make the processes smoother for our students. Billy talked about our policies and protocols. We're always working on those. And then part of our hiring and onboarding and training protocols always includes our integrated lens. So whoever comes into our office as a new employee, regardless of what team they're on, they learn what our integrated model, our shared values, how we work together, and from the very beginning start working together with everyone else. I'll go quickly through this one, but our emergency preparedness and safety protocols, of course, have to be more robust with an integrated model. There's a lot more to think about, but we also have a lot of additional expertise to leverage. So if there's an emergency that has medical crisis, injuries, things like that, we have our providers who are able to respond. And then for other kinds of emergencies, our mental health team is able to evaluate readiness to return to work, take care of our patients' and clients' psychological needs in situations like that. We've done a lot of planning, as I'm sure all of you have too, at the university, and we did a lot of planning for all different kinds of scenarios. I'm sure none of us expected a worldwide pandemic, but when COVID did happen, because of the relationships that we have established in our wellness center, we were able to come together and figure it out really quickly and decide who was doing what, where we were going, what we needed in place. So the interruption in student services was really minimal. And I think that speaks to the strength of the team and our commitment to each other and to our students, and just the constant communication. So in my new role as the Wellness Promotion Assistant Director, the role that Wellness Promotion really plays is pulling all the other pieces together and then educating our student body on all things wellness. So we started as a department of one, and then we were able to add a part-time grad student here and there. And I'm really happy to say that just this summer, we were able to hire 2 full-time wellness promotion coordinators, and now I have 2 grad assistants as well. So we're really able to expand our programming, but the foundation of when we started, because we were so small, we really leveraged the expertise of the other professionals in the Wellness Center, in the Rec Center, and across campus. These are just some of the examples of programs and initiatives that we have. Practicing Happiness was developed by our mental health team in collaboration with grad students at the Bethel College of Health Science and Nursing and our wellness promotion team. That's a 4-week workshop that students can take, and that's ongoing. Billy referenced our Narcan training. We're doing those regularly. That's a collaboration between health services and wellness promotion. RecFest is a huge event where we open up our entire building and all of our staff in Rec and Wellness, kind of showcase all the things we do and provide activities for our students. We're doing QPR suicide prevention trainings across campus for students as well as faculty and staff, and our wellness promotion team and our mental health providers, as well as other trained trainers across campus, deliver those trainings. We do first-year class presentations. All of us are involved with that. Fitness Buddies is an incredible program that was a collaboration between the Wellness Center Campus Rec and our College of Nursing and Health Sciences. They're doing a session today at 12. I strongly encourage you to go and find out more about it. It's been an incredible program to not only help students get physically active, but also make those social connections with others on campus. Our sexual health programming is a big collaboration between Wellness Promotion, Health Services, and then we also partner with our Multicultural Office and Residence Life. We've done wellness weekends before where we pull together staff from all different areas to offer a weekend of wellness. We also do yoga in our campus art gallery. One of our clinical psychologists does yoga classes for the UCCS community there. And then we also do collaborative cooking classes where our nutrition, our dietitian and our nutrition students collaborate with our mental health team. We've also had collaborations with our multicultural office to pull in the connections between food and anxiety, food and different mental states, and then also the different cultural cuisines and things like that. And then, trying to be mindful of the time. Really quickly, this is a fun initiative that we started last spring. As you saw, or if you've been to UCCS, you know that our campus is spread out in a big long line across the bluffs, and we have a large commuter student population. So one of our challenges always is getting students engaged and also making sure they know about our services and what's available to them. So we purchased a golf cart and we named it the Wellness Wagon, and we drive it around every week and take our services on the road for students, providing education, snacks, giveaways. We make videos and play games, so students are finding out more about where we are and what we do, and also getting wellness education at the same time. And that has been really a fun collaboration with all of our areas, as well as partners across campus. In addition to, I think, really helping the students and getting the word out, it's also given our mental health clinicians and our medical providers a chance to get out of the clinical setting and see students out on campus and interact with them in a different way. I'm going to blaze through these patient satisfaction surveys because I want Kathy to be able to share more about what we have coming forward. But basically, we survey our students every month, all the students that come into the Wellness Center. And just over and over again, they say that the collaboration has been beneficial to them, that the Wellness Center has helped them stay in school, that the services we provide have been critical to their success and their ability to stay in school. Overwhelmingly, they recommend the Wellness Center to others. And then I'm going to turn it back to Kathy to talk about some of the things we're doing going forward, because one of our core principles, I think, is we're always changing and moving. We never sit still. We're always willing to be open-minded and have a new conversation and decide if things are working well or if we need to change things. So, Kathy?
So this year, what we're working on moving forward, we've been doing those consultation groups that I believe Benik and Chrissy both mentioned, and Billy did too, a little bit more. Consultation groups for eating disorders and for our transgender non-binary groups. What we discovered was that the people that were actually treating them at the time would come into those meetings, but not everybody was getting the information and being able to learn from each other. So this year we've changed that. So we're now doing grand rounds during our once a month Wellness Center staff meeting. The first 30 minutes is going to be just business that we need to take care of. And then the last 90 minutes is going to be grand rounds where we can talk and introduce a client or a patient that we need to talk about. The idea behind this is to make sure that we're not only looking through our own lenses of our own profession, but then also looking through the other lens. So if I'm presenting somebody in grand rounds and I've got the medical team there, I'm really looking for them to be able to say, hey, did you think about this? Have they been tested for this? This might be something that might be important. So we're excited about that. We actually did our first one this past Monday and it was really successful. Then both Billy and I are going to start attending each other's staff meetings once a month. We're going to come in for the first 30 minutes, provide an opportunity for us to share anything we need to with their team. So when I go into the medical staff meetings, I'm going to be able to present anything that's important for them to know, but then also give them a chance to ask me questions, tell me about their concerns so that we can kind of work on anything that we might need to do. We're going to continue to streamline our protocols and procedures. We want those to look very similar. We want the language to be the same in all of our protocols and procedures. So we're going to continue to do that. And then putting assessments and referral processes in place. So we have the assessments, and now we're working on the referral process this year, making sure that the way we're referring is really easy on the student and effective for us. And then we're going to be looking at focusing for us, focusing on any kind of assessments, health assessments that we can do on the mental health side. We do that now because of what Billy started in 2020, doing the assessments from her side. So now we're going to try to do the same on ours. So that's just a little bit about what we're trying to get accomplished this year. All right. Any questions, comments, thoughts about our integrated care plan? Yes.
Yeah, just wondering where you get your ideas, and like we're always trying to understand what the gold standard is for college health and integrated care models and how we can push the envelope be better. Where do you pull from, or where do you get your resources, or who do you look to?
Do you want to answer that?
So, thank you. That's a very important question. I would say we have multiple sources of information for ideas and feedback. Our students is one of our gold mines for that. They constantly give us feedback, and we take it very seriously, and we always have discussions about what they're suggesting. Conferences, summits, we like last time we went to ACHA in May, and we did a different version of this, and we had a lot of people come up and say, this is what we're doing, this is how, different we are, and this is the problem we have, how do you address that, etc. So we are open to the nation, to our colleagues, to interact with us. And then being a nerd is a good thing. I do that. I read a lot. I try to do a lot of research on the outcome studies, etc., so that we have a good informed model to go from. And then, of course, finally, but not the least important, of course, the most important part is how we give each other feedback, like different expertise level areas, different cultures, different professionals come together to make this work. So we listen very carefully to each other's feedback in our collaborative work. Thank you for that wonderful question.
Anybody else?
Do you think about resources? Thank you for this great presentation, by the way. Do you think about resources that you wish you had that you don't have right now? I don't know how much time we have, but
I think we think and dream about them all the time. We are constantly working on that, and I think Benik and Stephanie can even answer that a little bit better on how they do it, but I'm watching what they do and how they are constantly talking to even higher levels up. And this is a whole initiative from the campus-wide, not just from us. We're hearing from the top up that this is really important, and so continually talking about where are we going to get funding. We were just talking on the way down here about some new grants that are being offered by community providers in Colorado Springs. So I think the message is also getting out to the community as well, of that these are things that we're wanting to do, and here's how we're going to need to have support, and at least financial support. Do you have anything else, Benik, you would share? Okay. Yeah. Great question. Thank you. Anybody else? Yes. So we don't take any insurance unless the student is needing to do some kind of medical service that's outside of what we can provide. So they just pay $20 a session for either mental health or medical. And then if they need something additional through medical, they might need to use their insurance for that. But otherwise we don't use insurance. Yeah. Anybody else? Okay. So this is how to get a hold of us if you need to reach any of us, if you have more questions that we can answer. And of course, there's the survey at the end. Thank you all so very much. Appreciate you being here and listening to our story.
Thank you.